All right. Thank you for joining us here today for our webinar about streamlining your accounts receivable process and going through some of the best practices for healthcare providers. My name is Tony Peterson, and I am the Vice President of Customer Experience here at NextTrust. I have been in the healthcare industry for close to 25 years. Most of that time has been spent working with different billing and EHR systems to try to maximize the profitability and the efficiency of processes within healthcare businesses. Before we begin, we also understand that questions are going to come up during the webinar for many of you. However, to ensure that all questions are answered promptly, we ask that you either write them down or remember your question for later. During the last 15 minutes or so of the session, we'll have time set aside specifically for question and answer. So let's get started. On today's webinar, we're going to cover the following topics. First, the financial impact of past due AR on medical practices. Second, we'll talk about the most common obstacles that patients face in collecting AR. Third, we'll talk about best practices for managing AR effectively. Next, we'll go through solutions for creating a seamless payment collection experience for your employees and for your patients. And finally, we'll talk about addressing the need to send some patients to collections and why and how you can do that more effectively. If you're like me and you've spent over or close to 25 years in the healthcare industry, you know that things have changed over the course of that 25 years. When I first started, most patients had a simple copay as their obligation. A $10 copay and the patient's side of the equation was done. Well, that's changed significantly over that period of time. Patient obligation is now over 50% of the healthcare dollar, meaning of each visit that occurs, the patients are responsible for 50% of the revenue that's going to come in from that visit. Research shows that as patient financial responsibility rises, the likelihood of collecting patient payments in a timely manner significantly decreases. This makes it more essential than ever for practices like yours to adopt efficient billing and payment processes. Failure to implement an effective process for collecting AR can have a very significant impact on the financial health of your practice. So let's review a few of these. First, when patients or insurance companies fail to pay their bills on time, it can cause a shortage of cash flow for your practice. This can lead to difficulties paying for supplies, rent, staff. All of these items can impact the quality of care that you provide to your patients. This can also result in increased expenses. Increased expenses that do result from the past due AR can put a significant strain on your practice's finances. In addition to reduced cash flow, past due AR can also increase expenses. For example, the practice might need to spend money on sending multiple statements, might need to divert staff attention to follow up on unpaid bills, or potentially hire a third-party collection agency to help you recoup the monies that are owed to you for services that you've already rendered. One of the other issues that come about as a result of this is reduced profits. Past due AR has serious financial implications on your practice, with approximately 20% of all patients being sent to collections, and the average medical bill that is sent to collections ranging from $750 to $2,600 per person. It's very easy to calculate the impact past due AR can have on your revenue. How many patients does your organization serve each year? What's 20% of the total number of patients seen during that period? 20% of the total patients times $1,850, which is the average amount sent to collections, equals the revenue that you're missing out on. It's easy to see there's a huge financial impact How many patients does it take to equal $100,000? Not very much. When past due AR accumulates, it can reduce your profits. You may need to write off some of the unpaid bills as bad debt, and this can further impact your practice's bottom line. So what are some of the issues that you face in collecting AR from patients? Well, first isn't even related to patients. Insurance claims and denials and delays can be a significant challenge for practices. According to most recent hospital data available from Becker's Hospital Review, it's estimated that 80% of medical bills in the US currently contain errors. When insurance claims are denied or delayed, it can result in unpaid bills and create administrative burdens for your practice. Medical practices like yours may need to resubmit claims, and according to MGMA, it costs an average of $25 to resubmit an insurance claim, which adds up very quickly. Not to mention the administrative burden that you have of following up with those insurance carriers to resolve issues, which can be time-consuming and require additional resources. In some cases, insurance companies may deny claims due to errors or discrepancies in the billing process, leading to further delays and additional administrative work for your practice. Ultimately, insurance claims denials and delays can result in significant delays in payment and negatively impact your practice's cash flow. Now let's move on and talk about patients for a minute. Patient delinquency and non-payment can and does pose a significant challenge for most medical practices. In fact, 83% of all practices report slow patient payments as their greatest payment challenge. Patients may fail to pay their bills due to a various list of reasons, including financial hardship, confusion about their bill or insurance coverage, or lack of follow-up from the practice. In some cases, patients may simply refuse to pay their bills, which can create significant financial strain on your practice. Additionally, practices that do not have effective billing and collections processes in place may struggle to follow up with patients and resolve payment issues promptly. The healthcare industry is no stranger to the phenomenon known as the Great Resignation. According to MCMA, 73% of medical practices rank staffing as their biggest post-pandemic challenge. Since 2020 alone, 18% of healthcare workers have quit their jobs. This puts an increased strain on practices dealing with the struggle of maintaining adequate staff and the added costs of turnover and training new staff. When patient volume is high and staff is stretched thin, practices may struggle to keep up with the demands, and often the efficiency of billing and processing claims is impacted. This in turn impacts the revenue cycle of the practice and the success thereof. In the next slides, we'll go through and discuss some of the best practices for managing this outstanding AR effectively. The first step that we're going to discuss today is establishing clear policies and procedures for billing and collections. To manage AR effectively, medical practices should have clear policies and procedures in place for billing and collections. These policies should include clear payment terms and expectations, as well as a process for following up promptly on overdue accounts. Practices should also have a process for escalating delinquent accounts to collections as needed. By establishing clear policies and procedures, practices can ensure that everybody understands their role in the billing and collections process, and that they work together efficiently to manage AR. According to a study conducted by the Department of Education, only 12% of adults had proficient health literacy, 53% had intermediate, 22% had basic, and 14% of people had below basic health literacy. 3/4 of Americans ages 22 to 64 report that they know how to use health insurance, yet only about 1/5 could calculate the cost of a routine doctor visit when their insurance is taken into account. Only 16% of healthcare consumers were able to calculate what they would owe for out-of-network lab tests with a capped allowable charge. To combat this knowledge gap in healthcare literacy, medical practices should aim to provide patients with clear, easy-to-understand bills that outline the services provided, insurance coverage, and patient responsibility. This can reduce confusion and help your patients understand their financial responsibility. Practices should also offer multiple payment options to facilitate prompt payment, such as online payment portals, payment plans, or payment by phone. By providing clear bills and payment options, practices can improve patient satisfaction and reduce the likelihood of delinquent accounts. Technology and automation can help medical practices streamline the billing and collections process, reduce administrative burdens, and improve accuracy. Practices can use billing software to automate billing and collections, generate reports, and track outstanding accounts. They can also use electronic health records, or EHRs, to track patient visits and treatment and use this information to generate accurate bills. By using technology and automation, practices can reduce the risk of errors, save time, and focus on providing quality care to patients. According to an ICPMG case study, automating workflows within your practice can reduce your processing times by 48%. The sooner a patient is made aware of the amount that they owe and the fact that they owe it to you, the sooner you can get paid. Mailed statements are the most reliable method for ensuring that a delivery actually occurs. Implementing a regular billing schedule can ensure statements are sent consistently. Using a service like BillFlash for printing and mailing statements helps automate this process, with approved bills sent the next business day. You can also increase the likelihood of payment by ensuring that mailed statements reach the correct address. One way to do this is by using address verification tools, such as the National Change of Address or NCOA service. The NCOA service compares patient addresses against the USPS Change of Address database and updates the address if there is a match. By using address verification tools, medical practices can reduce the risk of returned mail and improve the efficiency of their billing and collections processes. It's a known fact that most of the world spends a large portion of their time on their phones. In fact, 1 out of every 3 people check their text messages within 1 minute of receiving a message, while 85% of all people check their text messages within 1 to 5 minutes of receiving a new message. Research from Access One reports that 32% of people will pay their medical bills within 5 minutes of receiving e-bills and e-bill notices via text, email, or any other preferred digital channel. In addition, it found that while 25% of them will pay within 5 minutes after receiving the payment due notice, 30% will pay as soon as possible via a mobile app, and another 25% will pay promptly after receiving the notice via a patient portal. You need to communicate with these patients where they already are on their phones. Medical practices can improve the payment collection experience for patients by offering multiple payment options. This allows patients to select the payment method that is most convenient for them. And up there on the screen, there's a list of different options that you might want to consider. Payers today, or patients today, set up automatic payments for most of their utilities and services. Patients are getting out of the habit of receiving invoices, which need to be paid manually. Automatic payments have become a standard practice, and it's becoming embraced by more and more businesses every day. Implementing automated payments for your practice offers your patients the convenience they've come to expect when managing their bills. They can determine which payments are automated and how much is withdrawn each month. Automated payments provide practices with a simple way to ensure that you're paid in full and paid on time. BillFlash's autopay feature allows practices to automate this process of collecting payments for patient remainder balances. Offering payment plans to your patients also removes one of the biggest barriers to payment, which is financial hardship. This can be a win-win solution for both the patient and the practice. 90% of patients indicate that they plan to pay their bill in full if they're given flexible payment options. So you ask yourself, am I going to ask this patient for $500? Or am I going to give them the option to pay me $100 5 times? If you start with the $500, you're less likely to get paid. If you give them the option to split it up, you're more likely to receive that entire $500. While implementing best practices can certainly help practices such as yours manage your AR more effectively, there will still inevitably be situations where sending a patient to collections is the only option for recouping that revenue. According to MGMA, 23.2% of a healthcare organization's revenue is accounted for by collections from patients. That's nearly a fourth of your total revenue. There have been many changes to how medical debt collections work over the last few months and years. Medical debt collection agencies must now wait 12 months to report an unpaid medical bill to the major credit bureaus, as opposed to 6 months previously. So think of it this way, your delinquent accounts now have double the time to address and resolve any owed payments before the debt gets reported. From our experience at BillFlash, the sooner you send a delinquent account to collections, the more likely you will recoup the money that you're owed. It's also worth noting that starting in July of 2023, past due accounts below $500 will no longer be reported on consumer credit reports, making it more critical than ever for providers like you to implement effective practices for collecting on these balances, as the consequence of impacting a patient's credit score will no longer exist. Now more than ever, you need a trusted partner to help you effectively manage your billing, payments, and collections. BillFlash is a cloud-based SaaS offering a proven end-to-end financial solution for every step of the patient journey. From billing to payments and yes, collections, we have you covered. BillFlash unifies the statement, patient payment, and collections processes in concert with your organization's fiscal targets, making direct impacts on your revenue streams and solidifying business continuity. So what is it that makes it so effective? Our foundation is in optimizing the patient billing process. Over the last 5 years, we've been expanding our services to create a comprehensive financial solution for independent healthcare organizations. We've evolved to add e-bills, which are an online bill presentation and e-bill notices via text and email, pay services, which includes a model which allows you to utilize your existing merchant service account within BillFlash, known as Gateway Only. And recently, we added integrated collections and a complete end-to-end RCM offering. Our 22-year history has informed our current and future business model. BillFlash was created by payment experts who recognized the needs of independent healthcare organizations who were tired of seeing their hard efforts fall by the wayside due to process inefficiencies and a lack of a unified, streamlined system. If you're looking for an all-in-one solution to help get you paid, BillFlash is the answer. We thank you for taking the time to join us here today. If there's anything that you saw that was interesting to you, you can schedule a demo online at BillFlash.com, and remember to connect with us on social media. Thank you for your time here today. We hope you have a wonderful rest of your day and week.